Now, how do we prepare for any bioterrorism attack? These are important things that can be done now to improve preparedness for a BT attack. Familiarity with likely agents and clinical syndromes is the first step. It might be helpful to discuss surveillance programs within the hospital with infection control team. Although all hospitals have disaster plans, they are usually for natural disasters such as earthquakes, floods, etc. Few hospitals have specific plans for some of the things that are likely to happen in a BT, but it could be very helpful to do so. Some things that would be critical in disaster plans include decontamination and infection control, decontamination showers, isolation rooms, cohorting plans. Phone numbers of critical communications, local public health department, especially important for physicians. Numbers should be posted in ER, ICU, etc. Phone numbers or contacts to obtain resources that would likely be in short supply may need to go to federal agencies for help. Security preparations could be important to maintain order in the chaos and panic that would likely. The public health approach to bioterrorism must begin with the development of local and state level plans. Close collaboration between the clinical and public health communities is also critical. To effectively respond to an emergency disaster, health departments must engage in preparedness activities. Completion of the following 5 phases of activities prior to an incident are essential for successful response to a bioterrorist attack. First is the preparedness phase. Actions to be taken by different agencies to ensure required state of preparedness. This include evaluation of the laboratory facilities and upgrading the same, evaluating the hospital preparedness in emergency response and case management in case of an imminent attack, conduct training of health first responders, work out the legal provision and their implications, ensure that requirement of safe drinking water is met, ensure availability of adequate stocks of medicines and vaccines, coordinate with security organization, organize mock drills for health professionals, government departments, animal husbandry, security, law enforcing, and other agencies so as to assess their preparedness levels to act in. The next phase is the early warning phase. The early warning in the surveillance system includes activities like case definitions, notification, compilation and interpretation of epidemiological data, early detection and rapid investigation by public health epidemiologists is critical in determining the scope and magnitude of the attack and to implement effective interventions. The third one is the notification phase. It is mandatory to report any unusual syndrome or usual syndromes in unusual numbers to appropriate authorities. The activities in this phase include rapid epidemiological investigations, quick laboratory support for confirmation of diagnosis, quarantine, isolation, keeping healthcare facilities geared for impending casualty management, and evolving public health facilities for control. For the response phase, these activities include rapid epidemiological investigation, quick laboratory support, mass casualty management, and initiation of preventive, curative, and specific control measures for containing the further spread of the disease. The following: assess the situation, contact the key health personnel, develop action plan, and the implementation of the action plan. The setbacks suffered as a result of the bioterrorist attack are restored and lessons learned in this phase are incorporated in the future preparedness plans. The damage done to the public health facilities and essential items utilized during the response phase are replenished. Public advisories are issued regarding restoration of normalcy. Now that we have discussed the different biological agents used during biological attack and how to act and prepare during an attack, can now coronavirus be used for bioterrorism? In 2014, global outbreak of Ebola was avoided thanks to thousands of selfless health workers, the innate characteristic of Ebola virus, and a lot of work. According to Bill Gates, if anything kills over 10 million people in the next decades, it is most likely to be a highly infectious virus rather than war. Not missiles, not microbes. The source of the virus could be a natural epidemic like Ebola, or it could be bioterrorism. Based on Ebola outbreak in 2014 that killed over 10,000 people in Africa, there were no systems to prepare for a global epidemic. Ebola virus was contained due to heroic work by volunteers. Ebola does not spread through the air. By the time you are contagious, most are so sick that they are bedridden. It did not get into large urban areas. But with coronavirus, people can catch the virus, but they feel well enough to get on the plane, go to a market, or watch a movie instead of being bedridden like in Ebola. Terrorists can have attacked a vast array of targets with anything from mild pathogens to very deadly ones, instilling fear. But there is no need to panic. Can coronavirus be used for bioterrorism? Yes, but I hope it isn't. Be prepared, not scared. In summary, I have discussed the definition of dual-use research, bioterrorism. I have discussed the bioterrorism timeline, how to prepare during a bioterrorism attack. An effective public healthcare system with strong disease surveillance, rapid epidemiological and laboratory investigation, efficient medical management, information, education, and communication will be required to counter any act of covert or overt bioterrorist attack. These are my references. Any questions? Thank you.